everyone, in this video, we'll be discussing about ulnar nerve gliding exercise. So, what is ulnar nerve gliding exercise? Ulnar nerve gliding exercise, also known as neural glide or nerve forcing exercise, is a series of movements and stretches that are designed to mobilize and promote the healthy function of nerve in the body. It also can be helpful in relieving the symptom of cubital tunnel syndrome by stretching the nerve to reduce pressure. Cubital tunnel syndrome, also known as ulnar neuropathy or ulnar nerve entrapment, is a condition that involves compression or irritation of the ulnar nerves as it passes through the cubital tunnel. The cubital tunnel is a narrow passway on the inside of the elbow formed by the bone, ligament and muscle of the forearm. The other conditions that are suitable for this exercise are ulnar nerve stabilization and Guyon canal syndrome. The contraindication for nerve gliding exercise are acute nerve injury, nerve inflammation or active nerve irritation, recent nerve surgery, severe pain or increased symptom during exercise, and also certain medical conditions. The purpose of ulnar nerve gliding exercise are to restore natural dynamic balance between the movement of neural tissue and the surrounding mechanical interface, and also to improve grip and pain strength after tendon and nerve gliding, to decrease sensitive distal latency and pain relief, and also it may improve pain and body function. How ulnar nerve gliding exercise works? For the underlying concept behind nerve gliding exercise is that nerve need to be glide or slide smoothly within their surrounding tissue without any undue tension or compression. When a nerve becomes compressed or irritated, it can cause pain, tingling, numbness or weakness in the affected area. Doing ulnar nerve gliding exercise stretches out the interrupted ulnar nerve side to side, which then smooth the nerve path through the arm and facilitate regular movement of the peripheral nerve. This allows the nerve to glide freely along with the movement of the joint and relax the nerve from compression. This will reduce swelling and restoring blood flow to the nerve, which result in pain, swelling and inflammation reduction. This movement also minimizes tension on the entire nerve while localization of gliding to improve extranatural and intranatural mobility. This ulnar nerve gliding exercise consists of 5 parts with a total of 9 steps. Let's continue with the demonstration to get more clear. Extend your arm straight out by the side of your body, then bend the elbow so that your hand reaches towards your shoulder. With your elbow tucked into your side, turn the palm of your hand towards the ceiling and then to the floor. Extend your arm straight out in front of the body with a straightened elbow with the palm facing up. Slowly make a fist and then gently straighten out fingers. Slowly and gently begin to bend the elbow towards the body while at the same time gently bending the wrist backward away from the body. Then, keeping the wrist bent back, slowly and gently straighten the elbow as much as is comfortable. Then undertake the same process but with the arm to the side of your body. Extend your arm to the side of your body with palm facing downward. Slowly bend your elbow towards your shoulder and extend the wrist or fingers pointed to your shoulder. You can repeat this exercise from 2 to 5 times per session. It can be done for a few times in a day and it's recommended to be done every day until the symptoms are relieved. Before starting ulnar gliding exercise, it's important to take some precaution to ensure safety and prevent injuries. Firstly, consult with healthcare professional prior to the exercise. Do not proceed if you have recent fracture or post-surgery. Next, respect pain or any discomfort during exercise. Stop immediately because pushing through pain can worsen existing injury or lead to the new ones. Warming up prior to start any exercise, do perform some gentle ROM exercise to prepare your wrist and elbow for movement. And use proper technique when completing exercise. Lastly, allow yourself enough time to rest and recover in between ulnar gliding exercise session. This enables tissue healing and help prevent overuse injuries. For gliding, it can be done by increase the repetition gradually, like start with 2 until 3 repetition and increase to 4 until 5 repetition for each step. You also can increase the duration to hold in a position from 30 seconds to 1 minute. Next, you also can start from the easy step and gradually increase the difficulty of the steps. For the first evidence, the objective was to compare the effectiveness of ultrasound and nerve gliding on hand grip strength in patients with cubital tunnel syndrome. A handheld dynamometer was being used to measure their grip strength. Those patients were assigned randomly into 2 equal groups, which are Group A that received ultrasound therapy and Group B that received nerve gliding techniques, in addition to rigid night elbow spring for both groups. The final result from this treatment showed that there was a significant improvement in hand grip strength for Group B compared to Group A. This indicates that the nerve gliding exercise was one of the treatments that was more effective in treating cubital tunnel syndrome. In the second evidence, the aim was to address the diagnosis and treatment of patients with cubital tunnel syndrome. The study highlighted the use of current therapy technique to target the ulnar nerve, its supporting tissue and surrounding structure. Specifically, the focus was on justifying the inclusion of nerve gliding technique in the treatment approved. The study assessed a 70-year-old female student with cubital tunnel syndrome. She reported persistent pain around the elbow and paresthesia in the ulnar nerve distribution. The assigned treatment included nerve gliding technique, submitted joint manipulation, and a whole exercise program consists of nerve gliding and light free weight exercise. The substantial improvement had been recorded on both impairment and functional level, which were in pain scale, clinical task, and not with pain questionnaire. For the visual and scale for pain scale, show consistent improvement across the session. To conclude, nerve gliding exercise are significant in improving cubital tunnel syndrome. The last piece of evidence purposely to evaluate the effectiveness of conservative treatment such as wearing a brace or performing nerve gliding exercise. These assessments were conducted before treatment and reassessed after 6-month period. Those patients were assigned randomly into 3 equal groups. Group A had received fabricated elbow brace, Group B received nerve gliding exercise, and Group C received exercise modification as the control group. The fit for Group B was stated as below. For grid strength measurement, the overall strength improvement was not statistically significant and there was no significant difference observed between the group. For the neuropsychology examination, there was also no significant difference between the group. For the COPM, there were also no significant difference between the group. While the visual analog pain scale for overall improvement, there were no significant difference in improvement between the group. In conclusion, the applied therapy result in significant improvement within each group as assessed by the repetitive evaluation. However, there was no notable difference observed between the group.